Hi everyone and welcome to another executive interview. Today we have with us in the studio Shane Muller, the founder and CEO of SafeWatch, a well-being companion redefining mental health support. Shane, it's a pleasure to have you here today.
Thank you very much.
Now, SafeWatch seems to embody a unique approach to mental health support. So could you enlighten our audience about what sets SafeWatch apart from other mental health apps or platforms in the market?
Sure. And I'll start by saying there's over 1,500 or so apps in the marketplace. It's absolutely flooded. And I think every school project and everyone seems to bring out a new app all the time. It's crazy. So I would highlight three key things when it comes to the differences with SafeWatch. The first one, we actually founded SafeWatch based on research of adopting what we call this village approach. So with the app, what we're doing is we are helping people and individuals build and connect with their village. Another word would be care world or a care community. Essentially, it's an app also on a platform that helps people build connection. And the research says that when people live in community and have connection with a buddy or companions, they enhance their speed to recovery if they're not doing well, A. If they are well, they increase their chance of staying buoyant. So that community aspect is a key thing from SafeWatch, which is the first one. The second one, most apps seem to do one thing. There are medication tracker, there are mood tracking, there are journaler, etc. Most apps do one thing. With SafeWatch, we've adopted a very comprehensive tool set and capability set. So from the one single pane of glass, you'll be able to see all aspects of vitals and insights into how someone's going. That's the second one. And the third one, we've actually approached privacy in quite a disruptive way, very excitingly, whereby we've developed a unique key encryption technology that pegs to a blockchain network. And with this, privacy is actually ensured from every single person. Now I'll go one step further. We protect people's privacy, including from us. And there's not many companies on the planet that can claim that. So we would not know if the Prime Minister of Canada uses SafeWatch or not. Wow. That person's privacy is kept only with them. We've built the platform to ensure people can connect and use the service. So they're the three key differences.
That's indeed very fascinating, Shane. Now, speaking of the market landscape, how do you envision SafeWatch impacting the mental health tech sector? And can you shed some light on the scalability and potential market reach for a product like this?
Absolutely. So our firstly, from a scalability aspect, the app is now publicly available on the app stores, both the app and the Google Marketplace. And we had our official launch just in November to the mental health practitioner sector. And now with that app, it's in reach and accessible globally to psychologists, psychiatrists, psychotherapists, counselors in the marketplace today. So the first reach aspect we approached was the mental health practitioners. The second aspect, it's available for individuals to download from the app themselves. Whether they're seeing a professional or not, they can download it, connect it with their friends and families and best mates and colleagues, etc. That's the second aspect. There are several other aspects which I might cover a bit later, but the first market we've approached, as I mentioned, is this health sector.
Amazing. Very impressive indeed. Now, the use of blockchain technology for data protection is very intriguing. So could you elaborate, I know you've touched upon it, on how this actually ensures user privacy and security and how it aligns with investor expectations regarding data protection?
Absolutely. I might just paint a small backdrop on the security side first. So my background, I have a very long, over 25 odd years in technology, in cybersecurity, very uniquely. And as a matter of fact, my first job, I was 10 years old, I wrote a payroll program for a security firm, and that was the start of technology and also security. Now, I'll start by saying this without disrespecting any person, and that is the buzzword of blockchain seems to hook many people at thinking security. or privacy. Blockchain is a technology. It does not equal security or privacy. It is a technology. It's very important to get that clear. Most people blindly miss that point. That's the first aspect. What we have done, as I mentioned, we've developed some very unique key encryption technology. We use that key encryption technology to write data to something called an IPFS network, an interplanetary file system network. And that data is then pegged to a blockchain network. Now, as I mentioned, the essence of what we've done is we've created something whereby only every individual through their thumbprint, facial, or their PIN can access their data. There is no backdoor. So said another way, it may be similar to the closest thing could be Bitcoin. You lose your logins to your Bitcoin, you can't call anyone. No one's going to help you, regardless of how many dollars is in that Bitcoin network. So we've essentially built the same thing. We put privacy into the control of every individual, and every individual decides, I'll share this with my practitioner, with my best friend, with my parent, with my mate. That's what we've done from a privacy point. It's quite uniquely disruptive because most people on the planet have to trust big tech or big government.
Yeah,
and we've
that's
just
a good
disrupted that.
point. And that's certainly very assuring. It would be for to our audience. Now, for investors that are eyeing user adoption rates, what metrics or strategies demonstrate SafeWatch's effectiveness in fostering real connections while avoiding excessive screen time?
Absolutely. As I mentioned, I'm a technology person from background, and part of the research when we looked at mental wellness, we found very clearly that technology is a cause, if not a significant contributor to people not being well.
Right.
It's not the answer. Often it is actually an issue or a cause. The research tells us when someone's not well mentally, two things happen. Isolation increases and extra tech increases. And most of the tech is not designed to pull someone out. When someone's struggling at 11:30 at night, looking at the ceiling going, what's it worth it? Some fancy AI bot is not going to be there to save their life.
Right.
It's that real human element of care that really is needed if we're talking about people's lives. And that actually is what we're talking about. We're not talking about fancy technology, although it is. We're talking about how do we ensure we shift the dial on these crazy statistics that in Australia says about 45% of the population at some point will experience a mental wellness challenge in their lifetime.
Wow.
That means it's literally every person directly or indirectly with someone they live with or work with, because if you're that close, it will impact you to the person. So this is a very significant issue. It's a very silent issue because you can't tell by looking at someone.
True.
You could be a high-performance sports player, senior executive, you cannot tell. So what we're looking at and what we've done is carefully design something to ensure that the technology is non-addictive. What we're doing is in sizes, ensuring we can connect the right people in the village to that one person and bring the people that they know in their world closer to them. Not have them spend hours listening, hours typing, watching, reading, downloading. They're not KPIs there for us when it comes to all the hours spent. For us, it's that connection and fostering engagement.
Brilliant. That's so beautiful indeed, Shane. Now, investors often look beyond financial returns. So can you share some success stories or early indicators of impact from users that are utilizing SafeWatch?
Absolutely. I'll give you a couple of quotes. That's probably the best way. As a matter of fact, the ideal way is to actually have people talking and sharing directly. That is the best way. But 2 points. So firstly, SafeWatch is a for-profit business, but very clearly, it's an impact business. Very clearly. We're in the space and our objective is to make an impact to 25 million people's lives. That's our impact objective, using technology. Now, some of the feedback we've had from mental health practitioners and their patients would be things such as a parent mentioned this to a clinician once, and they said, finally with SafeWatch, for the first time ever, I have a glimpse into how my child's going.
Wow.
a practitioner said, finally, the burden of care no longer rests only on my shoulders, but I can solicit a care community around the patient I'm treating and enlist them who are there 24/7 while I'm only there 50 minutes every few weeks, and build scaffolding and help with that scaffolding ensure that this adult or adolescent person stays buoyant. That's some of the feedback. There's actually we have a whole string of quotes and references we've received back, but they're just 2 quotes that actually clearly demonstrate the impact. And I would say this, it's actually quite difficult to have genuine feedback from the end patient because most people like to keep this private.
Right,
People don't want to
absolutely.
walk around and talk about how mentally unfit they are. That's not done.
Absolutely.
So trying to have feedback is quite courageous when we do get it.
Definitely. And the way that you portrayed it, Shane, it's so beautiful. And it's definitely reached our hearts as well. Now, those stories definitely highlight the meaningful impact of SafeWatch. Now, before we wrap up this interview, it would be great to know that what milestones or future developments does SafeWatch aim to achieve in the short to medium term?
Absolutely. As I mentioned, we just launched to the mental health practitioner segment in November, just this year. And we're on track for our second and a very, very key market that we're looking to make available in April 2024. And that will be SafeWatch for the workplace. We have been working tirelessly all year to customize and fine-tune SafeWatch for the workplace, which is the objective is to address people in the workplace. We have over 10 million people in our workforce in Australia, and the statistics of 20% of people struggling reflects in the workplace as well. So we will be launching the workplace module to support any risks when it comes to mental wellness in the workplace. But this model won't only address people in what I call the red zone of risk. It'll also have address the green zone of people, the people who are well, and addressing things like mental fitness. So if they are high performance people, senior executives, sports people, whatever it may be, who are high performers, SafeWatch will also have an aspect to address that high performer to keep them high performing. So that's a couple of things in the near term that we're looking at with reference to our roadmap.
Amazing. That all sounds very exciting indeed. And we can't wait. I'm sure me, along with the audience as well today, can't wait to see the progress of SafeWatch moving forward. For anyone watching this interview, if you would like to get in touch with Shane or his team, please see the details at the side of your screen or in the description of this video. Once again, thank you, Shane. Really, the work that you're doing, it is amazing and it is so needed because I think there's nothing that comes above your health, maybe like your physical health or mental health. And we're all very grateful for you and your team for founding SafeWatch. And thank you so much for sharing wonderful insights about your work.
Thank you.
Thank you.